Hi, Dr. Tim Clare with ProHealth Wellness and South Charlotte Disc Center in Charlotte, North Carolina. If you like our videos, please make sure you subscribe and hit like. That way you get more of this information. We're trying to get more health information out for people so they can live better lives. I'm going to go through a little bit about doing what we call snow angels. I showed a video earlier of doing it on the sand. I'm going to show you the standing up version of it. So when we're doing a snow angel, 3 parts of our body remains attached to the wall. So I want you to think of it as a child when you do snow angels, or if you were in the snow and you were doing that. But what we're doing is working on our shoulders to try to get that plane of motion natural and normal, and to really work on bringing that back. It's part of our rehab for shoulder work, which we do. And as a sports physician, I oftentimes have to deal with a lot of shoulders and upper extremity issues for my patients. So this is a real highly effective way to take care of this and to get that motion back. So 3 things that need to stay in contact with the wall the whole time. First, the back of your head, your shoulder blades, and the back of your wrists. So 3 points stay attached to the wall all the time that I'm doing this. Now, what it's supposed to look like is as I come up nice and slow and steady, those 3 points remain attached all the way up. And I'm trying to get as high up as I can go with all 3 points being attached. Now right there, my shoulder starts to come off a little bit on my left, which is my bad shoulder. So I'm going to stop there and I'm going to work on that and hold it for 10 to 12 seconds. And then I'll release it, slowly working my way back down. Okay, now that's kind of the, I would say, that little nugget that you need to remember. And when you get to that point, that one of those 3 parts start coming off the wall, my head, my shoulder blade, or my wrist, when that happens, that's where you stop. You don't go any further. You don't make the other side work harder. We go evenly to that point. And at that point, if something's coming off that's far enough, I stop, I hold that for a good 10 to 12 seconds, and then I'll lower it down from there. Okay? And you can do that several times. That's something to do throughout the day to really work on bringing those shoulders. Yes, you can do it in bed. I've had patients ask me that. You can, but it's not quite as good as having a solid surface to work on. Even more, as far as challenging, is doing it on the floor, because now you have actually gravity helping kind of push things back and hold things back. All right, so wall slides are another thing that we'll talk about another time. I'll give you one more little hint of shoulder, is taking your arms here and bringing this, and then just bringing it back down. Again, trying to keep those 3 points attached, and then bring it back to neutral. And then you can go up the wall as well. So this is a modified version of what I just did. It's not working the full range like I do the other way, but it's another way to bring the shoulders back and work your shoulders. All right, so again, it's your future. Be there healthy.